Welcome back to Your Carolina. You know, helping our loved ones have dignity toward the end of their lives is the best thing we can do. And we are joined with Jerry Caitlin Paget from Wren Hospice to discuss what really hospice care is. Welcome, Jerry. How are you?
Hi,
Welcome
I'm
back
good.
to the
I'm
couch.
Good. Yes, I'm excited to be back. It's been a little bit, but I love being back.
Of course, this is a topic that not a lot of people want to talk about, but it's such an important thing to talk about when you talk about end-of-life care. So let's start with the basic. What is hospice? People may see it, but they're not sure exactly what it is.
Sure. So what we're looking at hospice is you do have a terminal illness. You have been diagnosed with a terminal illness. You're typically looking at the life expectancy could be 6 months, you know, and then what we come in and we do is we no longer treat the disease. We're no longer focusing on that disease. We're focusing on the person and symptoms and their quality of life. So making them as comfortable as possible, also focus family-centered.
What's the average stay that you guys are involved with a patient? I'm just curious.
Sure. No, that's a great question, and that's one of the misconceptions too. Is it's normally about 80, 81 is the average length of stay days.
Really?
So about 80 to 81 days. A lot of people, you know, think, oh gosh, it's like I've got 6 days, and that's just, you know, sometimes we see that if folks wait a little too long or if it's rapid disease process.
Right.
But typically,
so that quality of care and quality of life is the big part of that, making sure that both the patient and their families are comfortable, because it's a tough situation for everyone involved. So your team is really to make sure that they're having, you know, this time with their family, and they're getting to spend that time with some level of quality.
Absolutely. We are an advocate for the patient and their family, and to help support them through one of the most difficult times in life. And we have a team that comes in that does that we are focused on them. You know, we're 24 hours a day, 7 days a week.
Yeah, I guess so. Wren Hospice, a lot of counties you serve. Why don't you talk about that?
That's correct. So we serve 14 counties in the upstate. So we cover most of the upstate. And then we also have a Charleston office that covers 4 of the counties down there locally, right around the Charleston area.
Are there some other misconceptions that you guys can point to that people just generally just kind of, you know, get a little off every time
I think people don't realize that it's covered by most insurances, especially Medicare. People don't know that, and they just don't know all of the things that you get with that. You know, as far as they don't know that you have a hospice aide that can help with your activities of daily living, you know, bathing, dressing, those type of things. You have a nurse that case manages the whole team, and you get a lot of factors. Go ahead.
Yeah, I was just thinking, some of hospice care is in home, and some of it might be if they're in a nursing home themselves, right?
Right. So what we look at is where is their home. So it can be in a nursing facility.
Yeah.
It can be assisted living, independent living, and then we actually go to your home. So we follow you where your home's at, because that's where you're most comfortable.
Yeah.
And that's a big benefit too, to be able to be in the place that's familiar to you, and not in this like necessarily a sterile environment that makes you even more uncomfortable.
Absolutely.
So that's great. So for folks that are, let's say they think they're about ready for hospice, does the family contact you guys directly, or does a doctor contact? How does that work?
I always say we like to be a resource for you. Even if you're not hospice ready, we can go over that with you. And I always say, let us help you with end-of-life planning so you can be ready, even if you're not quite hospice ready. You might be, but we can help you, give you options and explain it so that you feel like you have the autonomy over your own life.
And taking the burden off of your family at the end of your life, where they're making decisions that they think is best for you, but there's always that question about is this what they would have wanted? So by taking care of it in advance, you kind of take that burden off of them in an already tough situation.
Absolutely.
But we as family members can reach out to you. We don't need a doctor's referral.
Yes, sir. To answer your question, no. You can reach out to us. Now, sometimes, a lot of times we do get a doctor's referral, but we actually love for someone to contact us just to ask us questions so they can be prepared.
There's your website.
Awesome. Yes. WrenHospice.com is the website. And like you said, a lot of misconceptions out there about what hospice care and what it includes. So definitely go on that website and take a look at the areas that they serve and some of the services they provide to make your end of life, you know, as you know, as pleasant as it can be. Because, you know, it's going to happen to all of us.
Absolutely.
Thanks, Jerry.
So, thank you so much.
Thank you all so much.